Communication, and I guess more importantly, the ability to express your opinion and your needs is a fundamental human right. So even if you have a physical voice but have trouble verbalizing or hearing or no voice at all, you have the right to be heard, or to a means of communication that ensures you're heard. And I guess it's our duty of care as support workers to empower a person to express their needs, their likes, their dislikes, anger, fear, happiness, and love. And it's an area that anecdotally, from people with disability, is often a neglected area, even though it's a human right. You can talk to a person and they'll often express to you how they're not heard or their voice doesn't matter. So it's really important to get communication right to help a person live their everyday life, to make choices and be independent. It's really simple, like they're basic principles. And the first principle is treat a person as an individual. Not everybody communicates the same way, so don't try like a one-size-fits-all approach. Ask a person how they communicate best, or if you have to, talk to somebody who's close to them about the best way to communicate so they can understand your message and you can understand their message. Treat the person with respect, so direct the conversation to them. Ask all questions to them, not their support worker, not a family member, directly to them. Use a normal tone. Don't use a sing-song, childlike voice. Talk to an adult with a disability as an adult. Talk to someone as like you would like to be spoken to. Allow time for pauses. If a person needs time to comprehend, don't rush them, don't put words into their mouth. Just become comfortable with longer pauses. Look at non-verbal signs and use non-verbal signs as well to get your message across. Think about their communication aid. So if they're using one, get to know how to use it. Watch them use it, allow time to see the response to and from between in a conversation. Learn signs, get on the internet, go on Facebook or apps to learn key signs, Auslan. There's so much out there that you can learn how to communicate with people with communication difficulties. Appropriate language is the language that we use when we're talking about or writing about people with disability. It's not demeaning language, it's not discriminative, it's positive language. So when we're talking about a person, we don't say a disabled person, we say a person with a disability. We don't say confined to a wheelchair, we say uses a wheelchair. A blind person is not the right term, we would use a person with a visual impairment. So focusing on the person, all of our language should focus on them as an individual and not so much on disability. Don't use tragedy, don't use suffering, focus on the things that they are good at, their strengths. Don't focus on the disability, don't make that the main part of the story. Okay? It may not be the main part of their life, it's just a part of life. Relax, don't get so caught up on using politically correct words. If you're worried about causing offence, talk to the person. What is it that I might say that could cause you offence? Don't use words that are patronising. Don't use patronising terms. Don't assume that a person needs help as well. Always ask if somebody needs help. As support workers, we're there to guide, to upskill, not to do for the person. So make sure that you always ask. Don't touch equipment, don't touch wheelchairs or a person or a cane without asking. Just be a nice human being is an easy way to put it. One thing that we say to our students a lot is always try and see the person first. There's some vision that we use where a young guy with a physical disability is asked, "What do you like to be called?" And he kind of looks at the camera and says, "What do you mean? What do I like to be called?" He goes, "I like to be called Jack. It's my name." And that's what we want to push across. Always put the person first, not the disability, the person first.